is just a huge honor for me today to be podcast interviewing Dr. Guy Gross, DDS, FAGD, MICOI, all the way from Salina, Kansas. He earned his doctor of dental degree in 2002, graduating with honors from the University of Missouri Kansas City School of Dentistry. Since then, he has become both a fellow and a master of the International Congress of Oral Implantology, a fellow in the Academy of General Dentistry, and a lifetime qualified member of the Crown Council. In his private practice, his main focus is on dental implants and reconstructive dentistry with an emphasis on sedation procedures and cosmetic dentistry. He also owns and operates a dental practice management company that operates and manages a large group of dental practices across the state of Kansas and Oklahoma. His biggest role in the management company is the mentoring of doctors and dental teams on clinical excellence and leadership. He has lectured both nationally and internationally on topics such as dental implants, case planning, practice management, cosmetic artistry, and 3D imaging. He has been a faculty member of OsteoReady, teaching live patient surgical courses to doctors from many parts of the world since 2014. In his spare times, he enjoys coaching football, basketball, and baseball for his two boys, ages 11 and 10, and attending dance recitals and softball games for his daughter, who is 8. He and his wife, Dr. Kate Gross, enjoy serving on dental mission trips and have done 4 humanitarian trips to foreign countries to date, with their most recent one being to the Dominican Republic last November. They also served as co-chairman of the Kansas Mission of Mercy, leading the projects to doing over $1.2 million in free dentistry over the course of 2.5 days. Their practice has also been named to the Smiles for Life Hall of Fame after raising over $100,000 for children's charities through their whitening programs. My gosh, you make every graduate from UMKC a proud man. How are you doing today?
I'm great, thanks. Great to be with you here.
Well,
today.
You're living up to your name, Guy Gross. Gross means a dozen. It means a dozen dozens, right? Gross means 144.
Right.
So
yeah.
You're about worth 144 dentists doing all this stuff.
Well, so I don't know about that.
So when you're mentoring young docs, when you look at Dentaltown, 250,000 dentists have registered on that site, and when we came out with the app, 50,000 downloaded the app, and those are mostly kids born after 1980. So you can basically say the millennials are all on Dentaltown on the app, and the baby boomers are on the desktop. Your these podcasts are on the app, and pretty much everyone that emails me about the podcast is really a millennial. In fact, if you're listening to this, email me howard@dentaltown.com and tell me how old you are. Tell me if you're a millennial or a boomer. But when you're mentoring young docs, what do you think they need coming out of school these days with $250,000 in debt? Some of them are $400,000 in debt. What do you think they didn't get out of dental school that you find really helps in mentoring them?
Well, I think that's a great question. I always distill it down with the docs that I work with that there are really 4 key things that I think are critical to be part of their way of thinking, I guess, as they graduate, and it has absolutely nothing to do with specific dental skills. It's the first thing I always talk about is, being willing to come in and work hard. I think I find with some of the young docs, there's a little bit of disillusionment at times when they come out and, it's like, I'm not instantly rich, with it's almost like we walk across the stage and instead of getting a diploma, we expected that we were handed some money or something. And I try to help people understand that the work of dentistry is challenging physically and mentally, and you've got to get in shape for that. You've got to be ready to really be productive, and you've got to engage your mind in the idea that it's a process, and it's not going to be something that is a overnight success story. It's going to take time. And then so that dovetails into the second thing, which is being a lifelong learner and being coachable. I love forums like Dentaltown. I love forums, like our OsteoReady forum, where doctors can continue to learn on a daily basis. They can continue to add to their armamentarium, their experience, their expertise. Even gaining the experience through somebody else, whether learning from others' mistakes, but being willing to be coachable, be a lifelong learner. Then the third thing is, come in and treat your team and your patients with respect, and that'll go a long ways. Truly learn to be a great communicator, learn to find ways to make people feel better for having spent time with you, and you'll do well with that. And then the fourth thing I always say is start to think like the owner of a dental practice, even if you don't own it. And that to me helps doctors to understand. And I always define that with the docs that I work with, but I want them to understand that, you cannot sacrifice long-term important investments for short-term gain, and your relationship with patients are always long-term investments. Everything you do, if you think of it as an owner would, being a good steward of resources, things like that will help you be a more effective dentist.
It all starts with, you said your first one was learn how to hustle. This person asked on a thread, advice for temporizing a toothache. What's the fast way to temporize toothache? He goes on to say, sometimes at, like at 4:30, someone will walk in with a toothache and they want to temporize it. And I replied, well, why are you temporizing? Why don't you do your damn job? I mean, if the tooth needs a root canal build up in a crown, it's 4:30. Why don't you do your damn job? Could you imagine if the fire department showed up at your house on fire and said, well, we all leave in 30 minutes. I think, what are we going to do? But you're saying the number one, work hard, hustle, and they have entitlement. And when you tell them that, they're also entitled to not having their feelings hurt. Have you noticed that? They all these universities, they don't want any speaker to come in and tell them something they don't want to hear. They don't want to hear a debate about any of the sacred truths. But yeah, working hard and hustling just goes a hell of a long way, doesn't it? Working through lunch, staying at the end of the day.
Yeah, I always say I consider that to be well more than half the battle, is if you're just willing to work hard and keep going when other people are thinking about quitting, and then the feelings hurt thing. I mean, hey, I'm not here to have anybody have their feelings hurt, but I'm also here to tell people the truth. And, the truth means if you're willing to accept the truth, that works for me as being coachable. And, a coachable person is going to continue to learn. And that's the key. I tell young docs, I'm like, listen, I probably made mistakes yesterday, probably earlier today already. I've made those mistakes, but I learn, and I if somebody needs to tell me a hard truth, I'll listen and I'll hear it and learn from it and keep moving. I think if we have somebody that's willing to tell us the truth and help us to be better, I think we should not resent them. We should consider them to be a great friend.
Another thing on these young kids, when you look at associates in private practice and corporate, their turnover is off the charts. It doesn't matter if, a lot of people say, well, there's 35 corporate dental chains that have over 50 locations, and some of them, their average associate only stays within 1 year, and it's considered the better one. The average is 2 years. They change jobs a lot, but it's not just corporate; it's private practice too. In my 30 years, for every one that I had stay with me a decade, someone else stayed a year or two. You know what I mean?
Right.
Why do you think their turnover is so high?
Well, I that's a great question. I don't, I can, as you're developing that question, I'm thinking of examples of people that I could see both sides of the same thing happening. The people that I see that I really have enjoyed working with for a long time have been the folks that really embraced the opportunity to have the power that comes from working with a group of people, being able to share ideas on a regular basis, being able to share some of the economies of scale of the higher technology equipment, like the 3D imaging and on and on, maybe CAD CAM, things of that nature. In addition to that, just the support that comes from, a lot of times we chose dentistry. I think dentistry is chosen as a profession more recently because of lifestyle reasons. Maybe there are a lot of people that could have gone to medical school or whatever, that sort of thing, and maybe they chose dentistry due to lifestyle reasons. Again, that sometimes can lead to disillusionment that it should be really easy, or that whole 4:30 analogy, like, well, I chose dentistry so I didn't have to work past 5 o'clock. Well, sorry, that's not exact. It's not a perfect science when you're dealing with humans and pain emergencies and things like that. Yet, having the ability to maybe take a maternity leave without it costing you an arm and a leg, or having the ability to have somebody support you when you're on, rather than being on call all the time, somebody to help you with all the things that, quite frankly, we dentists most commonly don't like to do. Whether it's payroll, accounting, hiring, firing, training, dealing with all the compliance and OSHA and blah, 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 the list goes on. I think the people that appreciate that are the ones that really can fit well in a group practice model. I think it really fits well. If they're a person that's such a lone eagle that they literally cannot work with other people and that sort of thing, that gets to me where it's some of the only times it really makes sense for a doctor to go on their own these days.
When I talk to the associates and the young kids and the CEOs of some of these deals, I think the ones that keep them the longest, like Heartland, actually has the most robust continuing education. And it seems like they stay the longest if they're learning something. Like, say they come out of school and they want to learn implants, and they go work for most private practice associates. The older dentist steals all the big cases and then abuses the kid and just gives them all the fillings and stuff and single units. And the ones that keep them say, you want the big case? Go for the big case, and I'll help you do the big case. So it looks like they stay the longest. They feel like they're being mentored and are learning something. And you're big into mentoring implants. So, and you were a teacher, instructor for osteo already. Now, did Brady Frank out of Seattle, did he sell that to someone on the East Coast?
No. Well, Brady still is, I believe, the majority owner of the company. But Brady has he's passed on the operational aspects of it to a company that's managing it, I guess you could say, doing the operations side of it. It's called Channel Traction out of Boston.
It was Channel Traction out of Boston. What's that other implant company out of Boston? The conical shape one. Bio.
Yes.
What is it? Bio.
Great question. There's a number of implant companies, I believe, around the Boston area, but I apologize. I'm not well versed on where they're all out of. So
Channel Traction out of Boston is the one managing Osteo Ready?
Yeah, but it's Osteo Ready. It's I think I probably misspoke on that a little bit. I think Channel Traction does some of the services for them relative to marketing.
So is that the implant system that you use, Osteo Ready?
I do, yes.
And so talk about that, because you're talking to a lot of millennials, and they come out of school and they see, there's anywhere between 200 and 400 dental implant companies around the world, and they're just like, why did you go with Osteo Ready?
Well, it was the first, to me. I had placed implants with a lot of different companies, or several different companies, over the course of my career. And, I saw that Osteo Ready had a unique position in that it was really the first implant company built for GPs, which I'm one of. And it's made so that it fits well in a general practice. Even though I do lots of, procedures, grafting, sinus lifts, connective tissue grafts, you name it, I do all of that sort of thing. Over the course of my career, as I had learned all of those things, I have kits for vertical approach sinus lift, lateral approach sinus lifts. I got all the different grafting kits and several different implant kits, including even a mini implant kit that I had utilized, and I utilize on rare occasion now. But the thing is I had increased the complexity and sophistication of my practice to where, like, every procedure, my assistant's like, so which kits do you want? What do you want? What do you want with this? Do you want and which implant do you want to place, and all these different things. And what I realized is that I had created a lot of complexity and a lot of confusion, quite frankly. And then, God forbid, if your main assistants aren't there one day and you got to try to explain that to somebody else. So what I started realizing is that, simplicity is the ultimate complexity. And I think Steve Jobs actually is the one that said that, so please don't think I can take credit for that. But the idea that, a 2-year-old can pick up an iPad and know how to use it, if you can choose an implant system to where it's intuitive and an assistant could pick it up and you can literally use it for virtually any case, to me that was attractive. So that was piece one of the equation. Second thing is that it's really all built around minimally invasive concepts. So to me that means the less amount of times we're doing incisions, having to place sutures, the less amount of times that we're having to graft or do sinus lifts, things like that. To me, that's a benefit to the patient, much the same as, if I'm doing a veneer case, I don't prep the teeth unless I have to, or unless the teeth are already damaged. I try to be minimally invasive there. I've just been that way with everything I do in my career. And so for patients, I find they heal faster, implants integrate faster, they have less post-operative pain. And for my business, it's a huge win because I get tons of referrals from patients going, I can't believe it that I had implants done and, it didn't hurt. I thought I was going to have to take pain meds for like 3 days and I didn't even take one, and that's a common story, with these types of cases. So I've endeavored over the last several years to teach people how to do that. And it's been, people have traveled either to my courses in Salina, Kansas, which isn't the easiest place in the world to get to, or I have courses in Kansas City. In fact, I teach another one here in less than a month in Kansas City, and the people have traveled from all over to learn how to do minimally invasive concepts because I think it resonates with GPs. The other thing that's great about minimally invasive is that, it doesn't take half a day to do an implant. It takes, oftentimes, we can do those procedures where my time is less than 10 minutes.
Nice. Associates, they stay the longest when someone's mentoring them. They stay the longest when the senior doc isn't stealing all the big cases and giving them fillings and single unit crowns. But my gosh, I've heard when associates that literally walk off the job at these corporates is because they're the assistant turnover. So they have a big day scheduled, and now they have some temporary assistant. And they're like, "Where's my assistant?" And I mean, I couldn't imagine going in there and doing a big case without one of your assistants who's been with you for 30 years or 10 years or 12 years. I mean, that is that is tough. So you like the and you mentioned Steve Jobs. I heard him say in one of his endless YouTube videos that what he was most proud of was not actually what Apple, the features that he did. It was the 95% of the features that he killed from his programmers that were always adding complexity to it. And he, again, I mean, we grew up in the age of Microsoft where Bill Gates would release that software. It would be riddled with bugs. He knew it. Everyone knew it. You'd pay $250 for a piece of software. Then you have to pay $1,000 to some IT guy to come in there and get it to work because of all the bugs that are in it. Agree or disagree?
Yeah, that's true.
And here was Steve Jobs. He wouldn't release it till it was bug-free, simplified. And he said, when I come out with this iPad or the iPod with music, he says, I want a 6-year-old granddaughter to be able to figure this out with his 60-year-old grandmother with no instructions. Whereas Microsoft spun up this whole industry of people trying to teach you how to use Word and PowerPoint and Excel because it was so unbelievably complex that no one even knew how to use it. So, Jobs was an amazing businessman.
Absolutely.
I don't know what he was on a personal level. I don't know if I would want him to be my dad, but he was a complex dude, to say the least. But so you like Osteo Ready because of the simplicity, and you can have one system that's intuitive for the whole staff. That's right in a nutshell?
Yeah. There's little to no question, what we're going to be doing when it comes to implant and grafting cases. My assistants know exactly what they need. So I've got a lot of old systems sitting on shelves in my office that are I had utilized for various things, and whether or not they actually ever cash flowed for themselves is debatable. But my Osteo Ready system, I had probably placed, somewhere between 1,000 and 2,000 implants before I got into OsteoReady. And then I have literally, even in just the last couple of years, have done more like 600 some a year. And, and it just has exploded quite nicely. I bet almost all of it has been with that one system. I mean, anteriors, posteriors, doing short, wide implants under the sinuses, doing, narrow implants in narrow ridges, things like that. We can do it all. And I've really embraced it and worked to find what it can and can't do. And so far, I haven't found too many things it can't do. And I really like that. And so it makes it fun for me to teach, because I really have seen some doctors transform their practices in a huge way. In fact, tomorrow I'm headed to our practice in one of our practices in the Kansas City area, and I'm working with a doctor there, back to the sort of the mentorship thing. But we're gonna treat, I believe, 8 patients tomorrow, and it'll only take probably about 6 hours by the time we start to finish on all that. And I think we will have placed maybe 11 implants. It's one of her first days doing it. I'll be there to help her. We'll go through it. She's taken my course, at least once, if not twice. And then she's come and observed me doing surgeries, and then I've gone to her practice. We've done some surgeries together, and now tomorrow is the day she gets to jump in and really get her hands on it. And so I'm excited for her to do that. And that's been a process that we've done, that I've done with my doctors. You're absolutely right. I saw so many, even from my classmates, class of 2002, I saw the doctor that hired them cherry picking their cases, turning them into glorified hygienists almost, and then, basically they stagnated. They weren't learning. And in fact, a lot of those people almost seemed like they never did recover back to where they were really doing great as dentists. They just got off to such a bad start in their careers. So my objective has been to help doctors really, accelerate their potential to do cases. One of my associates that joined me a little over a year ago, within her first month, she had a patient enlisted to do an $18,000 treatment plan. And she was our hygienist, lovely, experienced enough to help her get through it. She got it all treatment planned up, and I helped her figure out how to do it. And I did none of it. I just coached her through the process, even to some extent sitting, being in the room on certain technical parts, and she took it from there. But
so how many offices? So you're the owner of New Horizons Dental?
Correct.
Are you the sole owner?
Yes.
And how many locations do you have now?
I have 10 doctors and 8 locations.
You have 10 dentists and 8
Mm-hmm.
locations?
Mm-hmm.
And do you, and are they all named the same? Is it branded or are they all different names?
They actually all have different names. We utilize the names of more location-based names, so that it for specific reasons of primarily for a little bit of risk management, a lot of marketing reasons for that.
Yeah, and so do you prefer one doctor per location, versus 2? A lot of people who manage a lot of offices say that when you add doctors to a location, the HR, it's almost like logarithmic. Like when you have one doctor and 6 ops and 2 hygienists and 2 assistants and 2 front, there's almost no HR management. But as soon as you get 2 doctors, humans are very tribal. They're programmed at birth to follow the 400-pound gorilla. And when you have 2 400-pound gorillas in there, it's more confusing to all the other humans in the room. And by the time, and then when I saw, I'll never forget, Kaiser Permanente had 9 dental offices. They went from, one was 7 chair, one was 9 chair, went to 12, 15, went all the way to, I think it was like 80 chairs. By the time they got to 80 chairs, they had a complaint department. And I was standing there at the complaint department watching this lady slap her hand on the deal, wanting to know where her damn crown was. The director of that told me the same thing. He says, but anyway, do you find single doctor locations easier? Your motto is happy docs, happy teams, happy patients. Do you think it's easier to have happy docs, happy teams, happy patients with one doctor in a location versus 2 or 3 or 4?
That's a great question. I think doctors, you're right. Some doctors are wired to work on their own, and it works better that way. Others, would prefer to work in a group. Most of our practices, in fact, all but one at this point, are all solo doctor practices. My main location has 4 doctors.
That's in Salina, Kansas.
And I work there. And as does my wife, and so I think it works well because of our relative roles in that practice. We've sort of treated it like a super GP practice where each doc sort of has carved out their own niche, if you will, with mine being the implant aspects and the reconstructive things. My wife's niche is more specifically in orthodontics and sedation procedures. So we each kind of have our things that we do there, and it works out pretty well. So we take care of each other. If you got docs that are ultra competitive and they're in the same practice and it's a competition, some people thrive in that environment, and some people just go to war with each other, and it doesn't work well. So I'm very, very careful about that, and I think the solo doctor practice, in our smaller locations works really well.
Yeah, that's why all the comedians that left Saturday Night Live over the years said the same thing. It's just an all-out war to try to get your skit approved and get time on the show. And some people thrive in that environment, and other comedians just ran over and didn't like it. So go back to UMKC. You graduated in 2002. I graduated there in 87. You're from Salina, Kansas. I'm from Wichita, Kansas. Do you think when I got out of school 30 years ago, all the docs wanted to own their own practice, and it's different today in 2017? Do you think the percent of millennials coming out of UMKC at 2017, the same percentage want to work alone? Or do you think that what you're doing, taking away the business aspect of it so they can just do clinical dentistry, do you think that there's more people who want to do that and be an employee their whole career, or what do you think has the mindset changed in 30 years?
Yeah, I know you can relate to the idea that there's a mindset thing in dentistry where it seems to be sort of a noble pursuit to hang your own shingle and have your own place and all of that. That certainly has been the traditional mindset in our profession, and I don't necessarily have any problem with that. Yet at the same time, I do realize that there's economic drivers here that don't make sense as much as they used to. I mean, the amount of student debt load is just crazy for young doctors in many cases. Couple that with the pressures to start a family, buy a house, whatever. Hopefully they aren't going ahead and buy their Ferrari on their first year, but some of them do, of course, and that doesn't help them with their practice at all. But the mindset being that, I can get more access to technology, better cost drivers on all of my supplies, equipment, lab, things of that nature, reduce the work load in terms of all the extra stuff that I would be required to do. And so I think a lot of doctors, again, back to choosing the lifestyle aspect of the profession, it's not terribly dissimilar to what you're seeing in medicine, in that, I've seen a lot of practices being sold to the hospital in our community, in our area, where the doctors are saying, I just want to do medicine and come in, do my work, and then go home. And I think that makes a lot of sense. And the way that I sort of explain this is, I know doctors, optometrists, chiropractors, I see them, I know people that are doing their own payroll, they're doing their own accounting, or attempting to anyway. They're even mowing the lawn at their practice and stuff like that, whatever it is, they're doing it themselves because with the idea that they're saving money. And I look at it differently. I look at it with a concept of leverage, in that the more I can do dentistry and be great at dentistry, I'm going to budget a specific amount of time to make sure I'm either doing or learning dentistry, and now in a large extent teaching dentistry, which is learning in my opinion. I have a certain amount of time that come hell or high water, I'm going to do that every week. And so then the rest of my time is sort of an arbitrage spend between, does it make more sense to pay somebody to do this relative to the value that it would bring to my life? So now I choose things like coaching football and baseball and basketball and things like that over doing all this extra work myself. And every doctor is going to be forced to choose. There's always a cost. It's either going to cost you cash, or it's going to, if you're saying yes, just like Steve Jobs said, all the things he said no to are a big part of his success. So I say no to a lot of things so that I can say yes to my family. I can say yes to teaching. I can say yes to a continuing ed course, things like that.
So, when you're managing 10 dentists in 8 locations, are they all on the same practice management software?
Yes.
And which one did you go with?
We use Dentrix at this point with all of our practices.
Just Dentrix regular or Dentrix Enterprise?
Regular.
Regular? Do you use anything else, like some of these dashboard companies?
Yes.
Which ones do you use?
We've worked with Practice Analytics for several years. I know there are competing products out there, but that one has done a great job for us. They do well. And
tell us about Practice Analytics.
So it's a company that it basically pulls all the data out of each practice on a daily basis. Allows us to look at metrics down to patient by patient metrics per provider in every practice. So, you can look at your key performance indicators of how a practice is doing, certainly production collections, booked treatment for the month, things like that. You can project and forecast how your operations are going to go and where your cash flow needs are going to be and things like that very well with this software.
Now, do they
online.
Only work with Dentrix?
I don't believe so. I believe they could work with multiple software, and they have an app where you can pull it right up on your phone. So I could be, anywhere where I'm connected and look at what's going on in every practice.
And who's the CEO of that?
Jeff Clark, I believe, is his name.
And do you ever speak with Jeff Clark and trying to? I'm sure since you have 8 locations, you probably need a higher degree of sophistication than a solo practitioner person. Does he work
yes.
with? Do you ever talk to him?
Yeah, and they, to my knowledge, they've continued to evolve their product, even developing some custom solutions. But I'd be remiss if I didn't mention my operations director, Scott, that works with me and has helped me build this company. He really is the point man with Jeff, and they talk on a routine basis.
What's your point guy's name?
Scott Guest.
And is he like a accountant or a CPA, or what is his background to help you manage 8 locations?
He's neither. Scott spent 10 years in basically helping build the personnel and product side of a marketing company, and it was a database company. So Scott spent 10 years working in the trenches building another company, so he came in, started working with us, anyway, he's helped us from the time where I had a 2-practice operation at the time, and we've grown it from there together.
So UMKC is a public school. When we're looking at student loan debt, the debts are higher when they're coming out of private schools. What do you think the average debt is that you see walking out of UMKC, which is a public dental school in Kansas City?
I think it's still pushing. I think they're spending somewhere in the range of $60,000 a year just on tuition. So they're $250,000, 300,000, depending if they have to get to finance their living expenses as well.
But a lot of that is simply access to capital. So I mean, I raised 4 boys, and
Yep.
yours are 11, 10, and 8. So right now you think you're the greatest father in the world because all your children are perfect, and I'm just telling you that one by one you're going to give them a set of car keys, and they'll get in more trouble from age 16 to 18 than you could even. Yeah, so I call your time the calm before the storm. But talk to me after all 3 of your kids have a set of car keys and tell me how perfect they are. But
right.
No, I'm just kidding. But they start mailing my 4 boys credit card applications when they were like 10 years old, 12 years old. If I would have given each one of my 4 boys when they were 16 a credit card with a $300,000 line of credit, what do you think they would have done with that at 16? They would have gone out and bought 4-wheel drives and boats and jet skis and I look at these kids, and I mean they're complaining about their debt, but my God, they on spring breaks they fly and go on vacations and take cruises. They come out of school. I just met a guy the other day, graduating from dental school. He has an $85,000 BMW. I'm like, an $85,000. I didn't have a car in undergrad at Creighton University, and I didn't have a car in dental school at UMKC when I lived 8 blocks away from the dental school in Kansas City the first 3 years. I only got a car senior year because I thought when I graduated I'd need to have a car. I can't I can't be a dentist and walk to work every day.
Right.
And I never would have. For when we were little, a spring break was you went back home and lived with mom and dad for free and ate free at mom and dad's kitchen table for a week. I mean, I don't understand. There a lot. What I'm saying is this: their student loan debt is because they've had too much access to capital. I mean, and some of them decide they're going to get married in school and have 2 kids. Well, could you get married in school and have 2 kids if you didn't have access to putting $150,000 a year on a credit card?
Right.
If you just went in there and say, well, no, you have no access to capital, then they would have said, okay, well, we have no access. We're not having a child. So a lot of that is just because they were extending too much capital. But on that note, since they were very young and they did have way too much capital than they should have had, and the schools, I think, are seriously taking advantage of them. I mean, I think there's not a single dental school I know that has sympathy for this student loan indebtedness and saying, how can we teach these kids faster, easier, higher quality for a lower fee? I don't see any discussion about that. But when they do come out of school, what are smart investments for young dentists? You talked about, I mean, do you think, what do you think is, you talked about 3D imaging. Some of the high ticket items are 3D imaging, chairside milling, lasers, CBCTs. What do you think? For your 10 doctors and 8 locations, what do you think is a smart investment for young dentists?
So my perspective on that is, if I was a young dentist, which is hard for me to think, I'm not anymore. But
you're a baby. You're 41. I'm 50. Yeah. I'm 55 next week, dude.
Yeah, 15 years under my belt right here. I used to think 15 was like a whole lifetime. I think as a young dentist, the key is not to fall in the trap of trying to act rich, look rich, all of that. I mean, you certainly want to be, you don't want to act poor necessarily, but what my investment advice would be, steer clear of the fancy cars, the boats, the houses. I personally, I don't know why, maybe it's how I was raised, but I still don't drive the $85,000 BMW, even if I could, go pay cash and whatever. I mean, I'm not trying to say that. I'm just saying I don't do it just out of principle. I like to buy, I currently drive a 2011 Infiniti QX60 or something like that. I've had it for several years because I just think I found one that was like spanking new and somebody had taken great care of it, didn't drive it very much, and like, hey, that's just a lot smarter investment for me. So, but either way, I don't think the cars are anything to do with something for a dentist. So they're really the 3 things that you want to invest in my opinion, are 1, your education. Okay. I could show you ROI calculations on taking my dental implant course, for instance, and courses that I've done over the years. I took courses on learning how to do functional anterior veneers with David Hornbrook back when I first started, doing hands-on patient treatment, things like that. That has paid for itself over and over and over again throughout my career. It's like I built an annuity. Granted, I had to work. I mean, there was no, I had to show up and work. Same thing for implant courses, grafting courses. Even if you just spend your time getting great at crowns, getting great at fillings,
do you know
learning
David
endo.
Hornbrook's oldest son is named Phoenix?
Yeah, I know Phoenix.
And you know why?
Is it
because I'm the father. He doesn't like to tell people that, but that's he didn't want to name him Howard. That was too obvious, so he named him Phoenix, where Howard lived.
I get that.
Okay.
I totally get that. Yeah, so I spent a lot of money and time. It's like I had literally just got out of dental school, and I started kind of doubling down on my education thereafter, and had enough hours to become a fellow in Academy of General Dentistry within almost 3 years of graduating. And I found that to be the most. I could look at my investment portfolio, real estate, all this junk that I've accumulated over the years, whatever it is. Nothing pays like the continuing education that I invested in. There's nothing close. So I think you learn enough to go learn more once you get done with dental school. And unfortunately, it costs you a lot of money now. And it costs, my wife and I we both went through at the same time. We came out like $265,000 in debt. But thankfully, there were two of us.
Combined or each?
Combined.
260?
Yeah. So we started pounding away at that debt.
How come you didn't date one of the girls in your class that her father was paying? Your wife's dad was a dentist.
That's true.
Didn't you date all the girls who would have no student loan debt first before you start dating Katie?
Yeah, I just wasn't smart enough.
Do you think that was a bad move?
Yeah, well, I think it's been okay. She's been pretty solid on her performance on the back half of the.
Where's her dad practice?
He practiced in Salina, Kansas, actually, as well, and so he retired. Nope, he retired. He graduated UMKC in '78, and that was after a 4-year stint in the Navy as well. So I think he's 70 now. 78.
78. So, do you tell your 3 children that someone's got to be the 3rd generation dentist?
Yeah, well, they got the idea. We'll see what happens.
Grandpa, mom, dad.
Yeah, there's a lot of dentists in our family, that's for sure. And
seriously, how many?
Yeah, well, between on this side, there's the 3 of us, and then my brother-in-law. So my wife's brother married a girl who has 4 dentists in her family, and between all of us, there's a bunch of us out there.
Wow.
And then,
so I completely agree. I mean, watching dentists for the number one thing you said was education, and in my 30 years trying to track, who was successful. Number one, they hustled. Number 2, they were humble, and the education. It was about the people who did 100 hours a year, their whole career. Got so many great ideas, they always crush it. And the ones who were complaining that they had to have 20 hours to get their license renewed, didn't seem happy. They seemed burned out. They didn't seem to like dentistry or enjoy it. But my specific question is, you and I both were members of the AGD. You got your fellowship in the AGD. So did I. Do you think just getting the 100 hours a year is enough, or do you think there was something special or magical about joining the AGD, and did that help your journey?
Well, it did. It did help my journey in terms of accumulating hours and having a track that I was on. It sort of just happened, though. I guess a guy. I refused to be the guy that was constantly referring every case out. And so I really attacked endo education even while I was in dental school. And then I started really doing the same thing with implants while I was in dental school. So then I continued on that track. Well, then I started realizing that I obviously needed to be great at crowns and fillings. I was going to continue to work on that. But I wanted to be able to do the restorative cases, not just like the, I call it dump truck dentistry, where you see a cavity, you fill it, you see a cracked tooth, you crown it, whatever. I tried to do it as, hey, let's look at this full mouth. Why is there all this wear and tear? Why are they interested in improving their smile? And we started looking at ways to ask the questions of more comprehensively about how to take care of patients. And so the big cases started happening only when I was really ready for them, and I had the confidence to present them and recommend them, and the patients could tell that I knew what I was doing, and I could deliver the care. So that was a huge thing. The education, I can't underscore that enough, and I totally agree with what you said. The doctors who have invested and continue to invest in themselves and their education are most fulfilled and happy as dentists. The doctors who have stagnated and are trying to just get their hours by, showing up at the local dental society every month or whatever, and that's all they do, tend to be the least happy doctors I meet. And so that's something I said. And the second investment I would encourage doctors to make is in their own leadership capabilities and their communication skills, which parlays into building a great team around them. If you can understand how to build your team, I feel like I read a stat the other day that it's something like 33% of the workforce is actually engaged in what they do nowadays. And it said even in Germany, it's as low as 12% now. And it's on the decline everywhere. People are disengaged. They're not. And the interesting thing is being happy at work, like smiling and laughing all the time isn't necessarily a criteria for being engaged, because you can be happy sitting still doing nothing. The key to engagement is to have a team that understands the commitment to what we're trying to accomplish. And I've felt this way for years, that the success of my organization has been directly correlated to my ability to build the people in the organization around a consistent vision and a consistent culture that is a culture of success, I guess if you will.
So when someone's trying to learn leadership, and of course these kids, they know what they know, they don't know what they don't know. Navigating all the other 7.5 billion humans on Earth, hell, just navigating through a family reunion or a Thanksgiving dinner. I mean, that's the number one skill set you need. Is there any book or course on leadership? Looking back, was there anything you'd recommend on leadership the most? I mean, for clinical, you recommend Hornbrook and implants, but on leadership, anything ring a bell?
Well, one of the things that I've done over the years has been I'm an avid reader, and so I have spent a lot of time investing in time of my own. I go to the library a lot. I go to bookstores a lot. I'm kind of a geek like that, and so I've discovered that leadership is a moving target, and I fully believe that leaders are made, not necessarily born. I believe that you can learn skill sets that are going to move you in the direction of being a leader, but it starts by having an understanding of what are you really trying to accomplish in your practice as a person, as a dentist, as a human being on this planet, whatever you're really trying to accomplish, and then setting out by really leadership starts with knowing what that is and then living that daily and encouraging other people to follow you and helping them understand why that's important. I mean, I think it can be distilled down to fairly simple things, but I bet if I took you over to the library here in my house where I've put all my books, and obviously it doesn't have all my downloaded books that I've read, I bet there's 1,000 over there that I've read, and I continue to do so because I don't know that there's like a course you could take on leadership. Now, there are certainly systems that you can follow, and one of the best people I've ever seen at teaching people how to lead a practice, how to build a culture of success in their practice and things like that is Steve Anderson, who has an organization called TOPS. I feel like he does a great job with that.
Well, you know, my advice on that would be you're heavily involved in coaching your boys
Mhm.
football and sporting events,
Yes.
things like that. And I always say, you know, you're a special person. You're a snowflake. Who was your great leader? And go back in your life. Who touched you? Who motivated you? Who connected with you? Try to be that guy. And I bet a lot of these kids that are 11 and 10 years old that you're coaching, when they grow up, they're going to be great leaders because you're going to rub off on them. And every one of these little 10 and 11-year-old boys that you connect with, when they grow up, they're gonna want to be like you, and they're gonna use what you're saying, like you said on the beginning of the show. You know, when you're with people, try to make them feel good. You know, try to make them
Hmm.
the time spent with you is special. So I say, you know, who totally connected with you, be that person. But back to the, I'm gonna hold your feet to the fire. What about all these expensive things? The return on investment, small investments for young dentists.
Yeah.
What about all these high tech things? What is for your 8 locations? How many of them have lasers, CBCTs, chairside millings, all this expensive stuff where you can have as little as 3 purchases and then double your student loan indebtedness?
Yeah. Yeah. I'm like, I do own some equipment that costs more than my first house. And, and that's not bragging rights. That's just the reality of how it is. My first iCAD, I'm like, holy smokes, but here's my rationale. And there's a lot of garbage junk that I believe the salesmen try to get us to buy into, like, all the wonderful benefits of your Section 179 deduction and blah, 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 and how, an iCAD will pay for itself because you get to charge this much more every time you use it. And I think most of that is a load. My consideration is what investments, the first investments I would make in a practice start with things that you can do to make a patient more comfortable, things that you can do to generate more referrals, things that you can do to make raving fans out of your patients. If you wanted to build your practice, start there. And guess what? A lot of that stuff's pretty darn inexpensive. The second thing, is then to look at what else you can accomplish based on, if it's a technology investment. I mean, if you're going to buy a chairside milling or CAD cam or things like that, you have to understand that that's only going to be as effective as you implement it. So every time I make a budget to buy a new piece of equipment, the first thing I do is I also build a budget for implementation, and that budget includes both time and money. And if you don't do that, I feel like most investments dentists make actually fizzle out, and a lot of times they buy really expensive dust collectors. And so implementation is the more critical element of the investments that you make. If you can avoid all that, the pitfalls of lack of implementation, I think you'll go a long ways. So I have no doubt in my practice that having CBCT imaging has accelerated my practice because I make it available to patients. I use it to show them things they can see that we're able to diagnose and treatment plan minimally invasive implants because of it. And there is absolutely zero question that I have accelerated my implant practice because I have that technology.
How many of your locations have a CBCT?
3 of them.
And which one? Are they all 3 the same kind?
Yeah, we use iCat.
iCat in each one?
Yeah, my main practice that has the 4 doctors, we have the iCat Flex. So we upgraded that one and moved our next gen over to our Kansas City area locations, and then we have the Wichita area covered with the same thing. So, it has been a tremendous thing for us. It really has. Yet, if you're not ready clinically to invest in implants, some of that stuff doesn't make as much sense.
And why did you go with iCat? There's so many. Help them understand your decision-making process of why you went with iCat.
At the time I bought it, which I've had ICAT since 2008 or 9, I think. No, that's not right. Probably closer to 2011, 12 is when I bought ICAT for the first time. So I had placed a lot of implants with 2D imaging. And keep in mind that, anytime you're working in 2D, most of your cases need to be, flapped implant cases to see the bone. So I look at it as the ICAT helped me to start to do surgeries, virtually before I started placing them surgically. But the decision at the time was, one, built around their software. I felt like their software, especially at that time, was superior to every other software. So I was getting great image quality, which allowed me to, look at implant planning. We were doing Ceph tracings with it. We're doing airway evaluation. We're looking at, skeletal things. So we use it a lot, and it really has been helpful to us in our practice for all of the doctors, not just me as an implant doctor. If all you're doing is implants and that's all you want to look at, there may be better ones. There may be lower cost ones. For us, it was the best. The other part of it was, in my area, the support I got through Henry Schein and my local rep and things like that was far superior with the ICAT product. So I went with it, and that's still stood the test of time. They've done a great job for us.
Did you ever go visit them in Hatfield, Pennsylvania?
I didn't go to Hatfield, but I attended 3D imaging conferences actually in Dallas a couple times, and even ended up lecturing at some of their conferences after that, because I was a fairly early adopter. The way I was using the cone beam technology was something they hadn't seen before, so they had me start speaking to that a little bit about implementing it into a general practice. So
on the first one, you said, invest in stuff that makes patients more comfortable, more likely to refer. What specific things were you talking about?
Well, I would make sure that you've invested in, maybe spending a little bit to make the creature comforts in your office a little bit more robust, whether it's the nice memory foam pads for your chairs if you have long procedures, the ability to offer sedation procedures, or even just nitrous. I think TVs in the ceilings go a long way, headphones, neck pillows, some things that are really fairly low cost you can do to make patients way more comfortable. And I feel like, again, I've talked about my sedation, aspects of our practice. I invested in sedation training somewhere around 2004 or 5, somewhere in there. And I'll tell you, that has paid for itself a million times over. Again, not in the fees that I charge for the sedation, but in the cases that I can do for people that otherwise wouldn't get complex dentistry done. Because, they'll come in and they don't even have to know they were with me for a whole day, and they can wake up, as far as they're concerned, they wake up and realize that their dentistry is all done. So
after CBCT, what other do you think smart investments for young dentists? You said all these creature comforts that make patients more comfortable, more likely to refer. Then you said the CBCT, you went with ICATs in 3 of your locations. What about some of the other bigger what about chairside milling? Of your 8 locations, how many have chairside milling?
All of them have chairside acquisition units for and we've utilized iTero. So we use that to do acquisition of scans for Invisalign, for crowns, bridges, implant restorations, and all of that. Every practice has that, and actually only one practice has the milling capabilities. We currently outsource a lot of our manufacturing and milling to labs still. That's something that we've looked at insourcing. I just want to make sure that when we insource that again, back to Steve Jobs, I say yes to certain things, I say no to a lot of things, and I don't want to end up with a distraction that where we're spending a lot of money to get crowns that aren't even as good as what our lab can do for us. with the digital scanning, we're getting great results with our lab technicians. And so I'm very happy with that. The cost is something that fits in our budget. So as of now, it works. We may eventually insource our milling and manufacturing of the crowns and bridges, though.
So on the bread and butter, a single unit, most crown and bridge is done on a first molar. Most crown and bridge is sent to the lab, one unit at a time. On your average 6-year molar single unit crown, are you guys sending in a iTero scan or a triple tray impression with vinyl polysiloxane or a polyether like Improgum?
That has transitioned. Where we used to utilize polyvinyl exclusively, we now do probably 80% or more of them with a digital scan.
80% with a digital scan. And those all go to one lab?
Yes. I would say we have it down to about 3 total labs across the whole group of practices.
And any want to give any names? Dentists are always looking for a lab.
Yeah, well, I utilize. We've worked some with our main lab that I've utilized for 20 some years is actually Sunflower Dental Studios in Topeka, Kansas. They do great with the digital technology.
Sunflower Dental Studios.
Uh-huh.
And do they give you a discount since you're sending in a scan versus an impression? Since some labs say, well, if you send me Improgum in a quadrant tray, I gotta pay a human to pour it up in stone, trim the die.
Right.
So some give this. Do they give a discount for scans or not really?
Currently with iTero, you send the scan initially to them. They trim. They basically do the model work virtually, trace the margins, do all that, and then send it off to the lab. And so I believe the lab picks up the fee that iTero pays. So instead of it necessarily being that it costs you less, it just pass through. In effect, it saves us mostly on time and shipping and remakes. I mean, we see super duper nice quality with those restorations. So we've used them. We've used a company. We've used Arrowhead Dental Labs. Used another company called Albensi. There's been a number that have done a great job for us.
What was the third one?
Albensi, Albensi.
Where are they at?
Texas, and I'm remiss to say.
Did you ever meet with Arrowhead? That's Dick Barnes out in what is it, Fork, Utah, or what's the name of that city?
Yeah, they're in
South Fork, South Bend.
Yeah,
yes.
Yes,
did you ever meet Dick Barnes?
I've not in person.
He was maybe a little before your time, but everybody in my generation saw Dick Barnes, and
oh yeah.
And when you got done seeing Dick Barnes, you were Barnesified. And,
yes, I know.
Love that guy.
I definitely know of Dick Barnes. There's no question about it. I know exactly who he is.
Just an intense man. Just a really, really neat man. So iTero, it seems like the two biggest growth sectors in dentistry around the world, from Kansas to Kathmandu to Malaysia to Cambodia, is implants and Invisalign. iTero is actually owned by Invisalign, correct?
I know there's a relationship there.
Yeah, I don't
know.
They bought them because. So, are you doing? Is your 8 locations also doing a lot of Invisalign with the iTero scanner?
Yes.
What % of your doctors are doing Invisalign?
I would say at this moment in time, probably 80% of them are doing it, maybe more. We have a few, even in our main practice as of now, most of the work in orthodontic, anything orthodontic related, is done by one doctor. But the other doctors have started taking the courses to learn. They've done the basics and maybe even the intermediary course. And we've done a lot of that. In fact, I have a doctor study club with 2 weeks from today, or no, I'm sorry. Yeah, in 2 weeks or a week from Friday, I should say, we have our group of doctors coming in for study club Thursday night and Friday, and we're spending 4 hours doing Invisalign training with them. So we're continuing to allow them to learn Invisalign. We have a lot of great support around that. So it's been a fun adjunct to a lot of our doctors to be able to add Invisalign. And when you can scan it, and they even have an outcome simulator in the, built into the software that allows you to very quickly give the patient a pretty decent idea what their teeth might look like if they were straight. That has been a really cool thing. And then, having the training on Invisalign has allowed us to realize that there were a lot of things that we could do to improve outcomes of cases and get less of the having to go back and having new trays made or revision type corrections made mid-course or late course ortho.
Yeah, well, a lot of people love the orthodontics like Invisalign and the implants because so many countries the government controls the fees on root canals, fillings, and crowns. Like in Tokyo, London, Paris, you only get $100 US for a molar root canal. So and the dentists there tell me if they did it like we do it in America, it would cost them $300 or $400. So how do you do a $400 molar root canal for $100? So guess what they do? So guess what they do?
Pull the teeth.
Well, I mean, would you pull the tooth and do an implant and try to stay in business, or would you go bankrupt doing $400 root canals for $100? And you tell that to people. Like when people say that healthcare should be free, what does that mean? Does that mean the government's going to show up to your house, arrest you, and take you to a government facility and make you do free dentistry the rest of life? I mean, people are out of their mind when they say that things are free. There's nothing free on earth. Everything costs money, and there's economic models that are more efficient than other economic models. So besides CBCT, iTero scanning, any other you like taking the scan and outsourcing your milling? What about lasers? Any laser of your 8 locations? What about lasers?
Yeah, most of the locations have at least diode lasers, soft tissue lasers. We do have a water lase that I've had for a number of years, and I'll be honest, I don't use it a lot. There's a few indications where I need it here and there, but the diode, still, I use it for gingival recontouring, gingival lift type procedures. Use it occasionally for troughing, that sort of thing. My rule of thumb with lasers or with diode around crown preps is I only use it if the tissue's unhealthy. And thankfully, we've built in such a healthy periodontal program in our practices that I don't work on unhealthy gums very often. So, I might just use like a 0 cord real quick and put that in rather than taking away healthy tissue with a laser. So just depends on the situation, but I like to have it available for when I need it.
Two more quick questions. You promised me an hour. I've gone way over. You're in Salina. You have offices. Bottom line question. Do you think these dental graduates have a better economic opportunity going rural, like in cities like where you're at, Salina, versus staying in downtown Kansas City, which has UMKC Dental School? What's the graduating class these days at UMKC Dental? How big's their class size?
To my knowledge, it's 100.
100? And here I'm in Phoenix, and when I got here 30 years ago, there was no fluoride in the water and no dental schools. Now there's fluoride in the water, 2 dental schools. Midwestern is graduating 140 a year. AT Stills in Mesa's 100 a year. And there were no schools in Nevada. Now Nevada has a dental school in Las Vegas. There were no dental schools in Utah. Now there's 2. So the supply and demand ratio of dentistry in Phoenix has severely changed, which is a huge benefit for the consumer, the patient, and for the dental insurance companies, but not for the earning powers of a dentist. Would you say with UMKC Dental School dumping 100 dentists a year in Kansas City that you have better economic and opportunity leaving Kansas City and going, an hour or 2 hours out of town to rural?
Yeah, I do. In fact, we've seen doctors be able to go in and literally we have one practice, for instance, where, we always joke that the doctor's pretty much been elected mayor already, and he's only been there 2 years. They're so happy to have him, and, he's the one show in the entire county, and so for him economically, he came out of a private dental school, $400,000 in debt, and he's chipping away at it at a rapid pace. Meanwhile, doctors in Kansas City, I heard a guy say, in Kansas City you can't swing a cat without hitting 5 dentists. Whatever the heck that means, but it's kind of true. You go there and it's like there's a dentist on every corner and some multiples on the same block and whatever else. And I think, a lot of people love Kansas City and they've gone there. They lived there for 4 years. They want to, maybe they meet somebody from there, so they decide to stay there. But let's just say it's not a good business decision, in my opinion, compared to, I can drive to Kansas City in 2 hours and I'm completely fine doing that. And meanwhile, I can be in an area where they need me, and not be sitting there trying to, everybody's fighting for the same group of patients. And, it doesn't mean, I feel like every town has room for a good dentist, but it takes a while for them to know that you're a good dentist. And so you better be ready to buckle down.
I'd say in the like downtown Kansas City or Scottsdale, there's always room for a great dentist.
Yeah,
I would say
fair.
There's no room for a good dentist in Scottsdale. I mean,
Okay.
you got to go from good to great to differentiate.
That's fair.
You got to be great, and I'll tell you what. It seems like every dental student I know that went 2 hours out of the city is crushing it. And like I say, this guy's in a small town, and he's already ready to run for mayor. Last question. I'll let you go.
Yep.
Last question. So there's probably a lot of, when I ask these kids to email me, howard@dentaltown.com, and tell me, who are you, why you listen to the show, who do you want to hear, how old are you, whatever. I was really surprised at how many emails I got that were from D2, D3, D4. Mm-hmm. I mean, my evidence, it's greater than a quarter are still in dental school. What would you say to 2 kids dating right now? You married your wife out of your graduating class?
Yeah, we were even smarter than that, Howard. We got married before dental school and went all the way through and somehow survived.
That's amazing. What advice would you give to lovers right now who are listening to you in dental school and are thinking about tying the knot? Do you work in the same office? How do you work in the same office together and then go home and raise 3 kids? How do you not kill each other if you're with each other 24 hours a day? What have you learned going through dental school, being married, 15 years to your honey bunny? How many years have you been married?
19 years, actually.
19. What advice would you give that love couple listening to you right now?
I think that it's good to develop interests that you have outside of dentistry. I think it's okay to be able to talk. We've dissected this a little bit over the years. I mean, we looked at there were probably a lot more benefits than or pros than cons in dental school going through it together. In that we both understood what each other was going through. We were doing a lot of the same things. So when it was time to study, time to work in the lab, time to do whatever, it wasn't like we felt neglected. That certainly seemed to be a problem with some of the other marriages, I think, at times. But and so over the years, don't get me wrong, we've talked a lot of dentistry, and we've had a lot of dinners where we talk about our patients of the day and this and that. But we both continue to explore our own educational interests, so that we have unique perspectives on things. We both read a lot. We both invest a lot in health and wellness and exercise and things like that. And so, we make a lot of those kind of things.
Okay, but let me throw you under the bus with the number 1 complaint from all hygienists, assistants, and staff. They say that whenever the husband and wife are a dentist in the office, it's so confusing because the husband's always saying, go right, and then the wife's saying, go left, and the staff's like, well, if I ask the husband this, he'll say no, but the wife will say yes. And they always want an org chart. I mean, the Catholic Church only has 1 pope, then archbishops, The military's got 1 general, then captains, then infantry. How do you solve the problem that staff says, hey, how do you like working for 2 gods named Lightning and Thunder? And it's total confusing. Yeah. How do you solve the org chart?
Okay, well, I understand the question a little bit more clearly now. And I think One, we've spent a lot of, we set down usually every 6 months, and we plan our calendar over a year in advance. And we, in the process of planning our calendar, we put in the things that are most important, which include well, if we start with our personal things that we want to do, but we also set revisit our goals and our vision for our practice and that sort of thing. So we've been very clearly communicating from the get-go about where we're trying to go with all this. And so then we've sort of created a division of labor, if you will. Kate oversees the ortho side of the practice. I oversee the implant. But when it comes to the overall practice, I lead the practice. And then when it comes to the home, Kate leads the home. So
nice.
we still have a traditional approach, but we make sure we confer with each other, so it isn't one of those deals where left hand doesn't know what right hand's doing. It starts with communication. In fact, we've made it over the course of our practice time frame, we've made communication is our numero uno core value of our business and every business we've built. And we've always set time aside to plan for and revisit goals and check in on where we're at and make sure we're all tracking. I get together with my doctors every other week for at least a half hour to an hour to check in on where we're at, how we're doing. And then we do the same thing with our whole team at least once or twice a month, and it's on the calendar 12 months in advance.
And last thing I'll say is this. Remember, Doc, even if you're not married to your spouse who works in your office, if you have an office manager and the office manager's in charge of HR or whatever, and they go to her and ask her a question and they don't like it and they go to you and they ask you the question, they're human. So you have to listen, show empathy, totally listen them out. And then you say, well, what did Lori say? So they know that you can't go around the org chart. And in the Pentagon, which has 3 million employees, the number one thing that will send you to Leavenworth, which is right up the street from you, is when you do not obey your commanding officer and you go around your commanding officer and you go over his head and that ends in tragedy or someone gets killed, you will be in a cage in Leavenworth. The org chart is everything, and it's very confusing to the team if they don't know who their leader is. And they can't have two leaders. Every major religion is monotheistic. There needs to be an org chart. But, man, gosh, I could listen to you for 40 days and 40 nights. Guys, thank you so much for coming on the show today and sharing your thoughts. You educated my homies so well today. Thank you so much.
Thank you, Howard. Enjoyed the time, and thanks for all you've done for dentistry. I appreciate you.
Well, I hope you have a rocking hot day in Salina, Kansas. I've been there so many times. I grew up in Wichita, Salina, Topeka, Parsons. Those are all Hayes, Kansas. Those Kansas City. Those are all my stomping grounds. I love that town.
Awesome. Hey, good to see you, Howard. Have a great day.
All right, you too, buddy.